What an inspiring story. Thank you, Frankie. Hello, fellow Chordoma warriors. I like the warrior term because, I think it matches better the nature of the Chordoma. We're never truly sure that we're done fighting it. And more importantly, it captures our attitude better towards the disease. As you see, my name is Toni Neff. I go as Toni, and I think we can all thank my husband for having a short, easy last name. If I were to use my maiden name, I would probably still be spelling the first half of it. I was born in Bulgaria, as you can tell by my accent, and Shannon mentioned that. I got to grow up under socialism, communism, whatever you want to name it. Got a bachelor's degree in socialist economics. Got to live through the 1989 revolutions in Eastern Europe, upheavals, meetings, the fall of the Berlin Wall, the Ceausescu trials, the million-plus meetings, and we were all so excited and so hopeful that, freedom is here, everything will be all right. Yeah, freedom is kind of slow to come. You have to build it up. The economy crashes, so that takes even longer, but things are on the right path and looking much better. I've been here in this country more than half of my life, since '92, and I feel very grateful and lucky for this because just by being here, I was able to get a world-class treatment and support for this disease, and not a lot of people in other parts of the world can get that. So I really appreciate that. When Danny asked me if I would speak about my experience today, I was kind of hesitant. I'm a private person, and speaking in English, publicly is not, it's not very easy, but I guess it's more difficult to find a translator from Bulgarian. so I agreed because I remember how I felt when I first heard of a possible chordoma diagnosis. Pretty much like everyone else, you're scared. You go, just like Frankie said, you go on the internet and you scare yourself to death. And you read through all the medical sites and the medical terms, and you learn a lot of new words. And then, we want to know the facts. All humans do. But they scare us. And then I found, survivor stories, the Chordoma Foundation site, and this is what actually kind of brought me back on my feet. Gave me hope. It's like, yeah, other people have done it. You can do it too. You can get through this. So that's why I decided to share my story. In case it helps one person, I would be glad. So I would be talking more about, next one. Okay, in 2017, that's when I think it all started. I'll be talking more about my actual disease experience. I had a very sudden, strong pain in the coccyx area, not related to the payroll that I was doing at the time, but medications didn't help. I had to go to an urgent care, have an X-ray. That came out okay. My doctor gave me a steroid shot, all gone. 2.5 years later, I'm thinking this was probably related. The same pain comes again, only it doesn't go away from steroid shots. So I had an X-ray that was inconclusive, an MRI was recommended. I had the MRI, and I saw my primary doctor of 20 plus years a few days after that, and I still remember his words. He was like, I have good and not so good news. The good news is it's not in your head, you're not imagining it. The not so good news, you're 1 in a million. And I said, you know what, you're my first chordoma patient in my 40 years of practice with a possible chordoma diagnosis. And I even had to, he admitted he had to refresh his knowledge because he never had a patient like that. And so this is where that's how I was feeling, yeah. I don't like pictures of me. I'm not photogenic, so I'm going to cartoons. This is where my 5 stages started. I'm sure you're familiar with the Kubler-Ross 5 stages, and I think now they extended to, 11, 13. The denial, anger, bargaining, depression, acceptance. So, yeah, I added a few of my own, and, mostly fear, confusion, you name it, and, that's what it looked like. You're kind of bouncing all the time between different states of mind, and you don't really know what to do, and it's so, what was the most scary for me was the uncertainty. Do I have to, what do I do now? Do I have to get my things in order, or do I need to do something? Is there anything that I can do? So my primary doctor referred me to a spine surgeon. The spine surgeon was more of an orthopedic type surgeon. He looked at the MRI and gave his honest opinion. He said, this is a rare disease. It's not for me. Keep looking for a specialist. And I'm thankful for that honest opinion. And that's when I went back to the internet and found the Chordoma Foundation site. I looked at the vetted doctors in the Chicago area and contacted Dr. Walensky. He will be speaking this afternoon, his office, based on his credentials, and also I have a soft spot for Northwestern. I got my master's degree there. And I cannot tell you how my mental state changed when I met with Dr. Walensky. He is very, kind of calming, and he put, he gave me hope. He gave me a concise plan what we're gonna do, and this is what I needed. I needed something that, I needed someone to tell me, yeah, we can do this. We can beat it, we can do it. That's what I needed. And I had my surgery the day before Halloween, 2019. I remember Halloween was like the first big snowstorm for the season. Dr. Walensky did a wonderful job. He got my tumor out with negative margins, no complications. Post-surgery, I had the most wonderful bed, those air fluidized beds. But anyway, I had severe leg pain that kind of was hampering my recovery, preventing me from walking, sitting for any period of time. So I went to Shirley Ryan for a week for rehab, and they did get me functioning again and walking. And then I had the stitches removed, and my wound opened up. Yeah, so the doctors tried all sorts of medications, treatments, even the vacuum treatment, which honestly is not my favorite, but nothing worked. So I was scheduled for a second surgery, and meanwhile I went back home and had to have my wound cleaned and packed twice a day, at least. And this is where you can test your partner's commitment in sickness and in health. My husband, who is a software engineer, nothing with medical in his family, no medical professions, he learned from the nurses how to do that. And he did it without blinking an eye. And he was even joking that he now knows me inside and out. And I'm not sure what he saw in me, but, I'm forever grateful to, doing this for me and being the support that he was, and he still is. I had my second surgery in the beginning of December, and they closed the wound with a flap. I had to be on a bed rest for 2 weeks. I did not know what bed rest was. So I thought this was, just sleeping in and kind of leisurely activities during the day. Yeah, no. Those of you who have done it, you have to get very creative, how to wash your body, how to wash your hair, check out your privacy, by the door, how to do some work from the bed, what to do. But the team at Northwestern Memorial, they were great. They were very patient with me. They helped me get through this, and I'm grateful to them. I was home before Christmas, a few days before Christmas, and the leg pain disappeared totally. But I had pain in my pelvic floor, which is kind of common for sacral chordoma. I was looking forward to my first follow-up in March of 2020 to discuss, what the plan, the rehab would be. And then, of course, what happened in the middle of March. Everything shut down. We were in epidemic. Hospitals, doctors went into crisis mode. Appointments were canceled. Remote, televisits were not even a thing yet. So I kind of had to, figure out how to get control of the issues that I was having by myself. I was scared to go to anywhere close to a medical facility too. I wouldn't risk it. As most sacral patients, I ended up with neurogenic bladder and bowels. As they said, they checked out my privacy there. So, as you know, your brain gets signals from your body, sends commands, and the body totally ignores them. So that's kind of, the body is rebelling or being rude, I don't know, but, this is my body that I've known for decades, and now it's kind of acting so weird. So I had to learn how to cope with these issues. The bladder issues are they're easy. You learn how to cath, you learn how to prevent UTIs, that's fine. The bowel issues, not so easy. I was on the internet, Googling all sorts of sites again, and trying all sorts of treatments, methods, whatever, diet changes, laxatives, mini enemies, colon massages, diaphragm breathing, everything. Nothing worked, nothing helped the pain. Nothing worked consistently, I should say. So I stumbled upon something that kind of was the game changer for me. It's called the Peristine system. For those who are not familiar, here is a picture of the whole kit. So that's used, I found out it's used in patients with spinal cord injuries, paralysis, spina bifida, etc., including kids, mostly in Europe. So I initiated a series of, at this point, remote meetings, trying to find a doctor who can actually evaluate me if I'm a good candidate for that and prescribe it. And finally found a colorectal surgeon who did a lot of tests and said, yeah, you're a good candidate. And this system has, it has allowed me to get back to an almost normal life. I'm not affiliated in any way. I'm not with the Peristine. I'm not selling it. I'm just telling my experience. Before that, I could barely leave the house because you don't know. You don't predict. You cannot predict how your body is going to react. With the Peristine, I'm in control. So, if anyone has any questions about that, I'll be happy to talk afterwards with you. And a year after my surgery, in late 2020, I finally got some physical therapy. Again, Shirley Ryan for the pelvic floor. Their therapy is so wonderful, and that helped me a lot too. So I'm coming up to my 5th anniversary. I consider myself very lucky, to have a life that is pretty much normal. There are a few things that I wouldn't do, I wouldn't go camping because I needed my private bathroom, but then I needed that before chordoma. I still get anxiety before every MRI, and I don't think this will disappear anytime soon. But in between the MRIs, I try to just do whatever I would have been doing had I not had the chordoma. And one of the things that I always wanted to do, and now that I have the time and the physical ability, my husband and I would like to travel. This was my first trip during pandemic. That was August of 2020 to Mackinac Island. I ventured outside of the house at this point. But then this is last year in Bulgaria, and I managed to break my foot an hour after landing there. But yeah, it's all good. I didn't know that you cannot fly with cast on. That's long airplane flights because of the pressure, the low cabin pressure, the extremities, they swell. So my husband, he had to bring a boot, and then I was able to come back home. I hope you don't have to do that. And this was last month. We took another trip, and I intend to plan more trips. We have one planned for October to Canada. So what have I learned so far? For me, how I frame things. I am an optimist by nature, so I try not to dwell, okay, I was able to do that, I try to look forward. Okay, how can I do this now? I cannot do it the old way or the normal way, whatever. Let's find the new normal. So I learned to adapt to my new body, so to speak. Pretty much, sometimes I feel like a toddler, how toddlers learn, this is what this signal means, and this is what that signal means. It's kind of, getting to know a new body, exactly. I don't know if it's possible to rewire the brain, probably not after losing nerve roots, but it helps if you tune to yourself and start reading the signals and interpreting them. I had to modify my activities to the new body and plan accordingly. Travel, especially for long periods of time, takes some planning because of all the supplies that you need to take with you. And I learned, take breaks. Don't plan on walking, 10 miles, walking through the city the whole day. Take breaks. Also, carry your supplies in your check-in bag. And do not, in your carry-on bag, do not agree to the airlines when they start, insisting, oh, you have to check this in, oh, you have to check this in. Yeah, I've had my share of lost luggage. Keep busy. When I was diagnosed and treated in 2019, I was the controller for a startup that was growing faster than we could hire people. So I had to work very long hours. I even had my laptop in the hospital working. But yeah, I consider myself a workaholic, but I think that helped me in a way that it kept my mind preoccupied with work for a good period of time during the day. So I didn't go into the rabbit hole, kind of thinking, oh, this is what's happening to me. I don't recommend that particular coping mechanism, but if you have an activity that you enjoy, a hobby or something, spend as much time as you can enjoying it. It kind of helps also boost your confidence that you can do things. Be an advocate for yourself. Be proactive. That's what I learned during the pandemic. Depending on the circumstances, of course, doctors and therapists are very important, but sometimes you don't have access to them. So you kind of have to figure out how you can do it on your own. And you can do it. Take care not just of your body, your mind, as everyone knows. The foundation has a lot of resources, and use them or talk to specialists or to the unpaid therapists, what I call my friends, if you're lucky to have the, close friends. But yeah, I am grateful to my husband and a couple of very close friends that helped me through the whole ordeal and the pandemic and everything. And my last thing is, be an optimist, be resilient, and live wide. That expression, live wide, actually, that whole idea, that last lesson, I heard recently and I liked it a lot. And the way it goes is, we don't know the length of our lives, but the width is up to us. So that's my story. Thank you so much.